Thank you all for coming to this roundtable discussion. I thought this would be a great conversation to have because this year's VISTA cohort has several VISTAs, including yourselves, involved with the concept of food as medicine. And you know how we're always trying to get everyone to kind of interact within our little VISTA team. So thank you guys for being here. And I thought it'd be a good opportunity to see, well, not only get a definition for myself, but see how your host sites are implementing the idea of food as medicine, like what you guys see that concept as meaning for the work that you're doing, and I guess how food pantries and nonprofits generally can benefit from the concept. Um, but first, can we maybe go around with introductions, like maybe where you're serving and your VISTA roles?
Yeah.
Cool. So I see next to me, I see Sam. So Sam, would you like to go first?
Okay, sure. Yeah. Hi, I'm Sam, she, her pronouns. I am at the Tufts Food is Medicine Institute in Boston. It's situated inside of the School of Nutrition. So my site kind of has more of like a academic view of food as medicine. I'm surrounded by a lot of people who are doing researchers, who are researchers and doing trials and like PhD students and the like. So I'm really excited to hear about like your sites and what you guys are doing for food as medicine. I'll popcorn it to Karina.
Hi, Karina. I'm working at 18 Reasons in the Bay Area in California, near San Francisco. And my site, they started their food as medicine program about 2 or 3 years ago. But they basically just partner with like insurance plans, like Contra Costa Health Insurance, and yeah, pair with doctors and hospitals in that setting. And we do online cooking and nutrition classes. Um, yeah, and then it's all covered by insurance. I believe all the patients are under Medi-Cal. And then there's a component with CalAIM, which I think is the California initiative to make Medicare costs lower by providing a more comprehensive preventative view of health. So we're getting more, sorry if I'm like diving into it, but we're getting more funding for preventative care. So that means we're able to deliver bi-weekly grocery boxes that coincide with our cooking and nutrition classes. So they get a huge box of produce and whatever they need for the recipes. And each week we go over one of the recipes. So we talk about a little bit about nutrition, which is just like a reoccurring curriculum that we have. And then we have a like chef instructor that kind of teaches as well.
Actually, I have a quick question. Do you guys, are they medically tailored groceries, produce prescriptions, or like what
Yeah.
how does it become like a food as medicine as opposed to just like a like produce box with cooking instructions?
Mm-hmm. Yeah, they're considered medically tailored meals.
Okay.
Yeah, but I know the doctors at this like health center also do veggie prescriptions or produce prescriptions.
Mhm.
But yeah, for us, it's the medically tailored meal. Mhm.
Cool. I am Hannah Jury, she, her pronouns, and I work with the Madison area food pantry gardens here in Madison, Wisconsin. And we engage in food as medicine, I feel like in kind of a more rudimentary way. Our goal is growing fresh produce for food pantries to kind of fit into that model of whole nutrition. A lot of food pantries don't have access to fresh produce. They often get lots of cans, lots of dry goods. And so our goal is to kind of create that holistic sense of nutrition that a lot of food pantries aren't able to access. So not as much of the academic side, but definitely fitting into that food as medicine model.
Awesome. Well, it was great to see you guys already kind of jumping into the weeds there, but maybe it'd be interesting to see, I don't know, like for someone like me, like would you say, or could you give me maybe a definition or an organizational definition of how you and or your organization see food as medicine? Big, yeah, big question.
I would say for us, it's just a way to help patients with like diet-related health conditions navigate their diagnosis through food. So we see a lot of like we work with patients with diabetes and overweight, and then we also work with kids as well that get referred to their doctors to us. So we see like with them participating in this program weekly that like their HbA1c, their like blood glucose levels lower. And they just have like better health parameters after joining our program. So it's just a way to, yeah, help participants navigate their health condition through food.
We kind of see food as medicine more like similarly as a preventative measure. So because we are dealing with all kinds of food insecure people in Dane County, access to fresh, nutritious produce helps prevent a lot of those diet related illnesses that happen later on in someone's life. And so kind of trying to address the root cause of an issue as opposed to the symptoms later on is what we're looking at doing.
So I was just pulling up the Institute's definition of food as medicine.
Right.
So food as medicine programs integrate food-based nutritional interventions into healthcare to treat or prevent disease and advance health equity. These are health sector strategies that prescribe medically tailored meals, groceries, and produce to support disease management and optimal well-being based on the presence of specific health conditions as well as social needs. So food as medicine programs often leverage registered dietitian nutritionist expertise and offer culturally appropriate, often digital nutrition culinary education to patients. So I think with like my host site, because it's more of an academic institution, we look at food as medicine as sort of like this like prescription or thing that you give to someone, but it does like in we're not actually in practice giving the like food to patients, so we're not really thinking of it as like a preventative method, but more so like a help or like to be taken alongside other like medical care. So right now we're talking a lot about like medically tailored meals and produce prescriptions being used alongside like GLP-1s like Ozempic and how to yeah, manage weight and diet related disease with a pharmaceutical and food as medicine.
Oh, that's interesting. So like on your side, it sounds like your organization is more like on like the scientific side or like kind of a study. Whereas Hannah, you're more like you said. So I think that's interesting. Um, but before you guys like began this role, did you have experience in like the like education or previous experience, or is this something that when you like signed on, you're like, I want to be involved in this program?
I didn't have any experience related to food as medicine. I loved Hunger Free America and the things that this organization stands for, but I agreed to work with the Madison area food pantry gardens because I could garden. That was the whole draw to that organization for me. And then later on, kind of getting a better sense of the the gap in the emergency food system that we're able to provide has just taught me a lot about food as medicine, kind of as a practice that I was not aware of before.
Yeah, for my interview with 18 Reasons, I actually went through them first. I didn't realize that it was through Hunger Free America or VISTA. That was kind of like an after thing that I didn't really know much about. But during my interview, I was interviewing just for like a program coordinator role for their Cooking Matters program, which is just going to different community sites and providing free cooking lessons. And then we also do a little nutrition portion, but they're in person. Um, so, and then she told me that there might be a position open for a food as medicine program coordinator. And I was like super thrilled about that because I'd heard a little bit about it with like the produce prescriptions and stuff because I studied nutrition at UC Davis. And I was like, oh my gosh, this is so perfect because I wanted that slightly more like clinical aspect of nutrition education, providing nutrition education. So yeah, that's my story about it.
I kind of came into the role through HFA because I was a volunteer coordinator with HFA. And then my boss knew that I was interested in food equity and potentially looking into a master's in nutrition or public policy and thought that the Tufts position would be a really good fit for me. So that's how I ended up here. But yeah, being part of this program was kind of like something that was important to me.
Great. Well, do you guys think, like, just through the exposure of now being Vistas in these roles for a few months now, um, that like you were learning about food as medicine, do you think it like complicates like the functioning of food pantries in any way, or is something? Well, I guess where I'm coming from with this question is I think a lot of people see food pantries as, you know, when Thanksgiving comes, I'll donate my, you know, cans of soup and whatever. Um, but I think food as medicine as a concept is saying that, you know, nutrition is kind of a right, or it is a right, not kind of a right, and that food pantries should be taking on this kind of responsibility to not only like give the bare minimum, but uplift, you know, give everyone the same opportunity to have the same kind of access to food. Um, and I don't know if you guys have had enough like exposure or you're involved in enough things at your host site to kind of get a sense of how the program is being received at your host sites, but I'd be interested to know um, your thoughts on that.
I think at Tufts specifically, we're not thinking of the onus as being on food pantries so much as it is on healthcare insurers. We have this collaboration called the Network of Excellence, where we're partnering with like Medicare and Medicaid with the 1115 waiver to have like an agreement that a certain amount of money can be spent on food as medicine instead of other medical interventions um, to just be a more cost effective way of treating diet related illness. Um, we are like partnering with community-based organizations or I'm actually starting a collaboration with community-based organizations that um, are medically tailored meal providers or produce prescription providers. But I think mostly food as medicine is kind of a response to the um, faulty medical system that we have here that is more like based on reactionary pharmaceutical prescriptions rather than a more holistic approach to food and nutrition insecurity that causes these diet-related illnesses.
So I do a lot of work with food pantries, and we are finding that more and more food pantries are no longer being used as emergency supplements to regular grocery store use, but they are becoming the only way that families and households can afford groceries at all. And so, in my experience, while I don't deal with the medical side of things as much as y'all do, making sure that food pantries have access to that kind of holistic sense of nutrition is more important than ever because families aren't going to get it anywhere else.
Mm-hmm. Yeah. Yeah, we don't really deal with the food pantry side of things. We have a wholesale food grocer that delivers our meals for us. So I think it comes out of our grants and, the Cal AIM budget in order to provide that.
I just want to amend something I said earlier based off of what Hannah mentioned, which is I think that like food is medicine is not just a response actually to the broken healthcare system, but also the broken food system that causes illness through like food as well.
Yeah, we talk a lot about the choices that like I said, families and households make when it comes to providing for their family members, where it's like so much we are seeing that families will choose rent over groceries. And because the cost of like housing is rising so much, the need for the emergency food system is increasing as much as the prices of food themselves are increasing. And that's definitely something that we're trying to be cognizant of, that it all goes hand in hand.
Mm-hmm. Yeah, I love that prevention,
Yeah.
Mm-hmm.
Because if you have to choose between, okay, this might not be as nutritious, but it's filling, my kids won't go to bed hungry, or I know that this is going to give them this, it will fill this nutrition need, but it doesn't have the same caloric value, they're going to choose the more filling, less nutritious option because it's usually cheaper for one, and it's more accessible, and it makes more sense to them financially.
And I think that that kind of highlights a bit of a disconnect between the kind of like ivory tower of academia a little bit and the actual like boots on the ground, like what's happening and how are people accessing these services. Um, in our mission statement at the Food is Medicine Institute, we have equity in our mission statement, and which is amazing. But because a lot of the people that work here are researchers that just want to know that food is medicine works, and with what populations does it work, and is there a certain type of food is medicine prescription that you can give a certain illness, like if you're high risk pregnancy, is there a certain amount of produce prescriptions or medically tailored meals, and what are those that would better address that as opposed to someone who's dealing with um like type 2 diabetes. Yeah, so there's, I think that's kind of where we're interested, and I think that's where the VISTA role actually becomes really important. Because Hannah and I were talking about doing a collaboration of using the kind of like Tufts expertise of like knowing what food is medicine is, being leaders in the food is medicine field, and then Hannah's farm, which is like much more connected to the community, knows of people who are experiencing not just food insecurity, but nutrition insecurity, and then illnesses caused by that nutrition insecurity.
Mm.
Yeah, the president of our board currently is a family doctor who works at a clinic near the farm where I work. And so we're definitely tossing around the idea of maybe implementing a more concentrated food as medicine approach at the garden where I work to kind of see how it would work. Because we so often function as kind of an intermediary where we grow the food and we give it to food pantries, but it's not the same direct contact. So Sam and I have definitely been talking about the idea of maybe implementing a case study, but we'll see.
We'll chat
That would
tomorrow.
be exciting.
It would be cool. It would be so cool to kind of to see how it would pan out. Brian is interested, by the way. I need to email you about that. But
Great.
yeah.
I was sitting at the edge of my seat waiting for an email.
I know. I had my wisdom teeth out yesterday, so I was up for the count. But yeah.
Well, that sounds great. And I know there are a few other vistas that are involved in this type of work. So like, I mean, in my emails, I always stress like find each other's emails, get the Slacks, and I mean, it sounds like you guys are already doing that kind of thing, which is amazing. So very cool stuff. And I think, Karina, you already said kind of how your host site is implementing like the concept and everything, but is there any like project that you guys are all engaged in like currently or within like the realm of, food as medicine? Um,
Mm, I would say it's kind of an ongoing project. It's a whole community program, a whole section of our nonprofit. Um, so yeah, we just started a new cohort or program, which is called Healthy Lifestyle. Um, and that is more accessible to people rather than getting a referral from their doctor. It's a little bit more open to like the general public. Um, but yeah, as I mentioned before, we work with diabetes patients, um, slight overweight, obesity, children with obesity, and we also work with pregnant and postpartum women to provide like more food access and to provide that food as medicine curriculum so that they can learn how to cook with those ingredients and how to like use those ingredients for their condition.
Sorry, just for me, could you repeat the name of the program you guys are doing that's more accessible than getting the doctor referral?
Yeah, it's called Healthy Lifestyle.
Okay, thank
Mhm.
you.
Yeah. And Sam, I actually had a question. So it sounds
Yeah.
like where you're working at Tufts, that you're doing more of the studies, or that institute is doing more of the studies. Is that being like sent to policymakers, or is that like being helped to make policies or to keep food as medicine as more of like a prevalent thing in the US?
Yeah, so it's interesting. So some of the people that are part of the institute are grad students, so they're doing like a thesis project on nutrition. We have a postdoc that's doing like a study of taxation on sugar sweetened beverages. So it's kind of like all across, there's like lots of studies all across the board. We do have someone who is in DC like year round that is like helping like lobby for certain like food as medicine policies. I think an like specifically pertaining to the 1115 waiver is really important, but also um it's like health insurance companies is the big one. So we're trying to develop a business case argument for essentially the cost effectiveness of these of food as medicine. That investing in that now will actually save insurance companies a lot more money because also the cost of GLP-1s is going up, and that's a large amount of population that would qualify for medically tailored meals or produce prescriptions. Um, but yeah, for me, like in terms of my position, I'm more so working on right now, we're launching our advisory council, which has a bunch of people from like various different sectors that can help with like kind of the business case for food as medicine. And then I'm really excited about the regional collaborative, which will be a collaborative of a bunch of community-based organizations, universities, and medical schools or hospitals to participate in food as medicine, kind of get these voices that we haven't really been hearing from, especially from the community-based organizations.
Okay, awesome. Yeah, because I know in California, I think it was this year or last year that they just started this whole new initiative where they gave, I don't know, I want to say like 20 million or something for these programs
Mhm.
uh, for like preventative measures for
Through
diet
the
conditions.
like through Medi-Cal.
Yeah. hmm hmm
I'm from California. I'm actually from San Francisco, so
Oh,
Bay
no
Area
way.
proud. Yeah.
Okay, nice.
well, I mean, I think the work, just listening to what you guys have had to say, like, because um, my Vista experience has been different. Other than like being a Vista leader with HFA, it has been outside of the realm of food security. So this has been very edifying for me personally. And I'm honestly like excited about the like the projects you guys have going on. They sound really impactful. Um, and I also, you know, it's just within the, I mean, you throw words around like food security around, and there are buzzwords within just like nonprofit work generally. Um, but I think conceptually, like the work that you guys are engaged in, is important, and just like not just complicating like the work that we're trying to do, but trying to get like a bigger picture to help more people. So um thank you guys for coming to talk about this today. And I hope that you keep interacting and and creating new opportunities for projects and synergies and stuff. But the work that you guys are doing sounds really, really cool. So thank you.